Right now in WREL, the latest data from the State Health Department shows more than 25,000 new COVID cases in North Carolina last week. Today we spoke with a doctor who said this number is likely much higher than that. Good evening and thanks for joining us. I'm Gerald Owens.
And I'm Deborah Morgan. The doctor said we could have 7 times as many cases, meaning that number from across the state could realistically be more than 175,000 new cases in 1 week. WREL's Adam Owens joins us now live to talk about why there's such a large discrepancy. Adam?
And Deborah, it all comes down to testing and how we do our testing. Take this testing site, this drive-through testing site here in Wake County, here behind me, for example. It will be closing in about 2 weeks. That can make tracking the virus in our area a little more tricky. At the same time, people thousands of miles away from here could tell us a lot about how bad the virus could get. Look at these changing colors. They show the path of COVID spread across the state over the last 2 weeks. 18 counties are now considered to be at high risk. That includes Orange County, where 80% of the population has at least one shot of the COVID vaccine.
We're still in the pandemic phase.
The dominant variant spreading right now is BA.5. Dr. David Montefiori says this variant can work its way around antibodies created by our vaccines to protect us.
And that's why we're seeing all of these breakthrough cases.
Vaccines and boosters are still vital to protecting against serious illness, though. But knowing how bad the virus is spreading is getting more difficult. Many people who get sick are testing at home. Those results do not get picked up in state-reported data. In Wake County, drive-through testing sites will soon close. County leaders say people have other options, like those home tests.
Do you have any concerns about that, the fact that testing may be rolling back at a time when we could have some increased concern?
I do. I think we need to beef up our resources and continue to, monitor this pandemic until it finally, settles down.
Health experts are learning a lot by looking to South Africa. Montefiori says people there are just coming off a BA.5 COVID wave. That tells them how bad it could get here.
It's not likely to be as large a peak as what we saw with earlier variants.
That is encouraging, but scientists are already looking at potential new COVID variants. This virus isn't going anywhere.
There's always going to be the next variant. And we can't, panic every time there's a new variant.
But at the same time, Deborah, the doctor told me multiple times that you should still get your vaccine because it can keep you from becoming seriously ill. And as a matter of fact, right after you get your shot, you do have enough antibodies that it can keep you from getting infected at all. Back to you, Deborah.
Adam Owens reporting live. Thank you so much, Adam.